All right, welcome everybody. It's Reagan Archibald with Your Healthy Self, and so excited to have you all here today. Big announcement was our hack last night. We introduced cold showers and cold exposure as part of our 100-day fat burning challenge. We are on week 4, so week 4 that means we've gone through. We're almost we're kind of rolling up on a full month at the end of this challenge, and it's been fun to see everybody's interaction. We had one of our members said, if you sing happy birthday twice, that will get you to the 20-second mark. I mean, that's a goal for the cold shower. So there you go. Get in your cold shower. You can start with heat. That's not a problem, but you just want to finish with cold. So that was a big challenge. We had sleep. Make sure you sleep well. We had exercise, fitness, getting rid of sugar, and then we have breathing that goes in with that. So there's some very fun things we've been working on. And today we've got a really special presentation, special show. We're going to be talking about thyroid conditions and thyroid health. And so what I'll be covering with you today are some things that can radically change your life when it comes to thyroid health, because as many of you know, this is what got me into the medicine. Is I had my own struggles with thyroid conditions and Hashimoto's. And so I'll be talking about that. And I'll give you guys some insights because I know many of you on the show, even today, and many of you that will listen to it, after it's recorded, thyroid conditions are becoming more and more prevalent. And we're starting to see that some of the downstream effects of the modernized world and some of the pollutions and the foods that we've been eating are now starting to show up in our thyroids. And so today, feel free to ask questions as we go through this, but I'll be talking about the 3 phases of care when it comes to thyroid health. We're going to go through some of the myths about thyroid, hypothyroidism, Hashimoto's. We'll even talk a little bit about some of the foods that you want to eat. And we'll talk about how to make thyroid hormones with iodine and tyrosine, and then how to activate your thyroid hormones with selenium, iron, and zinc, and then how to move T3, which is the active thyroid hormone, into cells with fatty acids like omega-3 and DHA and EPA, and why the thyroid hormones are so darn important. And so as we go through this, we'll have some kind of self-assessments where you can look at your own thyroid, and then we will be able to see if there's actually some things we can do, some clarity, some things we can do as a team to give you clarity on your thyroid and to help you move forward in your health journey. So, so let's kick it off. So first of all, how many of you on the show today, how many of you would say that you've got some thyroid condition that you would love to have better answers for? And you can raise your hand in the chat box. You can, ask questions as we go through. Excuse me. Some of the thyroid symptoms are, you'll have cold hands, cold feet. You can have issues with your hair. You can have swelling. We're going to talk about all of those. So let's jump in. So what I'm going to share with you are the 3 phases of care necessary to reclaiming thyroid health in 90 days. And so just a little bit about my background. You guys know me. I'm Reagan Archibald. I'm the main producer and founder of Your Healthy Self with Reagan, a podcast and show and webinar that's inspired thousands of people to transform their life and their health. I'm a thyroid expert. I'm a functional medicine practitioner, and I'm also a licensed acupuncturist. And so the things I'll be sharing with you today, once again, they go back to my origins of wanting to find better health for myself. And so my journey happened in my undergraduate work. I was at the University of Utah, and I noticed that my health started to decline significantly. I noticed I was kind of getting a little bit of it's just softness, pudginess, even though I hadn't changed my diet. My face started to become more swollen. I felt older. I would wake up in the morning very sore and stiff, and I would exercise and couldn't recover. And I just got frustrated. And suddenly my hair started thinning out, my eyebrows, they started thinning. And so I went and had my, just some basic blood work done. I went and spoke to a few doctors up at the U, and nobody had any solutions for me. And so finally I started doing some research on my own and found, oh, naturopathic doctors look at things differently. And I was just studying pre-medicine, so I was very curious, and I ended up going to a naturopathic doctor who ran my labs. And I still remember when he said, hey, you got to look at this. And what we found is my thyroid peroxidase antibodies were elevated. They were up at 680. And so that was a big wake up call for me. And we'll be talking about TPO today and thyroid globulin antibodies. But as he looked at this, he said, look, there's only one way that I'm going to be able to work with you. And that's if you work with this acupuncture Tao Tan, this acupuncturist. And so I said, yeah, no problem. I don't know anything about acupuncture. So I read a book about it. I went to the library. Yes, that was pre-Google. So I went to the library and got a couple books on Chinese medicine, books on naturopathic medicine, and just started reading about it. And as I started my treatment plan, the first time I got acupuncture, I was so nervous. My hands were all sweaty. I did not know what was going to happen. And I happened to have back pain because Tao Tan does not speak great English. And so he's just like, I fix, what's your problem? And so I said, oh, I got low back pain, some thyroid issues. He's like, we take care of low back and thyroid. And then, needles went in. And then when I got up off the table, I could move better. My back felt better. And I said, wow, this is crazy. And so every time I'd go in, I just noticed that my vitality and my health just improved little bit by little bit by little bit. I started studying with Tao Tan, learning all about the medicine, and then went to Chinese medical school in Hawaii. It was an integrated medical school that only accepted 8 students a year. And so I was fortunate because I was actually able to get accepted. And it was such a gift to me because that's a school where it was funded and founded primarily by Earl Bakken. He was the inventor of the pacemaker. And so he was able to attract some of the best doctors in Western medicine from all over the world. Just renowned cardiologist, our gastrointestinal doctor was very fun to work with there. And then we had, as far as the Chinese medical side, I had a great mentorship with my Japanese teacher, Dr. Miyakawa. And you guys may not know this story, but in the Japanese culture, it's different than the American culture, because the Japanese culture, you don't just pay for education like you do in America. In America, you write the check and then here's all your assignments and your books and everything. Japanese culture, they don't, there was no money exchange. My teacher just said, hey, I'll teach you once I feel like you're sincere and that you are worth teaching. And so for the first 2 months, I just, cleaned up her porch, cleaned her clinic at the end of the day. And I just hoped that at some point she would accept me in as a student. And because I knew I could not master the medicine without a mentor. Chinese medicine was never meant to be practiced just by reading books and regurgitating the information. It's a lot more hands-on than, the Western medicine or even functional medicine. And so, I started studying with her, and I remember the first time after about 2 months of cleaning, she finally said, Reagan-san, that's what she used to call me. And she'd say, you come in, but don't move the air. And so I was there in this treatment room, and it was so phenomenal because I actually heard her have a conversation with her patient about telling the patient it's okay to die. This patient had terminal cancer, and I said, wow, what an interesting experience. My first experience as a student, literally my first patient observation was my Japanese teacher teaching somebody how to die and how to get relaxed and how to get healthy enough and strong enough so that her patient could move to the other side. And I thought it was the most beautiful experience. And at the same time, I couldn't breathe because I wasn't supposed to move the air. So I was trying to breathe very calm and not, just be like a fly on the wall. But it was a phenomenal experience. And then I went on to teach for my teacher. I was the first American ever certified in Seitai Shimpo. acupuncture, and came back to the United States. Well, I guess it was in Hawaii, so it's still the United States, but I came back to Utah, founded my clinics in 2004. And, I went from a small little 2-room clinic to now we've got 6 clinics, 5 in Utah and 1 in Albuquerque, New Mexico. And we're growing very quickly, especially now that we've turned into Anodyne. So I have a passion for helping people because it's radically transformed my life, and realizing that the thyroid is at the core of so many aspects of health. um, I believe that this is one of the most important things you can learn about today. So let's talk about the thyroid. So what are the 5 worst thyroid symptoms? Well, let's talk about that. So many of you, you've seen Forrest Gump. And so here's, for those of you who are just listening, it says, when you're lost in the brain fog, but you know it was important, right? The worst thing about, for me, for the thyroid symptoms is brain fog. So how many of you have ever experienced brain fog where you walk into a room and you're wondering, where are my keys? And why am I in this room? And what is going on in my brain? Or you're so foggy, like you can't even read at night because your brain's just so foggy. You don't remember. You read a page and you're like, I used to be great at this, but now I got brain fog. So brain fog is different than cognitive decline, but they can feel the same. And so one of the things about brain fog is you will be very forgetful. You will not remember what somebody says. And with thyroid conditions, you can have a little bit of anxiety too. So you can be writing a lot of fiction in your head. So brain fog is a big one. The second worst is always tired. So you can see Post Malone, he's got always tired tattooed on his face, and we appreciate him living here in Utah. He's a great artist, but how many of you have ever wanted to just get tattooed on your face, always tired? Please leave me alone. I'm just too tired today to even make a decision or to think about that. And so that's a big thing with hypothyroidism, is you're going to be tired because one of the big things about the thyroid hormone, the way that it works in the brain and the way that it works in the metabolism, is T3 is kind of like that charge. So when you plug in the Christmas lights and then they all light up. So T3 is essentially like putting Christmas lights in the mitochondria of your cell. It gives it a charge. It gives it the energy that it needs, essentially the gasoline to keep things burning. And so that's something that's really critical when it comes to your overall health. If you don't have good thyroid hormones, imagine trying to get your Christmas lights to start shining if you didn't plug them in. And so one of the big components of the thyroid is yes, it helps you reclaim your energy levels. And so if you love your couch, if you have the afternoon, like just incredible desire to always like, man, I got to lay down. It's between 1 and 3 in the afternoon. This in Chinese medicine, we call liver yin deficiency. But if you feel that, like at that 1 in the afternoon, you have to take a nap, there's a good chance that you can have some significant thyroid issues. The other thing with the brain fog is when you're tired, it's an energetic tired. It goes beyond just a normal tired. And so that love for the couch is your, that's one of the big things you want to be aware of. All right, another top 5 worst thyroid symptoms is weight gain. And how many of you have told, well, you just need to lose weight and exercise. That's why you're putting on weight. It's your fault. You've got a problem with putting your fork in your mouth, right? And so you're saying, no, it's not that, because I can tell you, I've had hundreds of patients who've come to me in tears because they've said, look, I can't lose weight no matter what. I'm eating an 800 calorie diet, a 1200 calorie diet. I've done it for months. I go to the gym almost 2 hours a day, and I cannot, my weight is so stubborn, it won't move. And that's one of the classic symptoms of thyroid. And she said, no, I go to my doctor. My doctor said my thyroid's normal. You're wrong, Reagan. I said, well, we're going to run labs that actually will get to the root cause of this. And so if you have weight gain, and weight is in a thyroid condition is going to be pretty much everywhere. So you're going to notice that you put weight on your thighs, on your arms, maybe under your chin, in your belly. And it's weight that can be stubborn. And you can even have some pitting edema. So right now, if you're like, man, I think Reagan, this is me. I've gained a lot of weight and I don't know how to lose it. Well, one of the things you can do is go down to your ankle and squeeze it, and where your thumb squeezes, if you see a little indentation, that's called pitting edema, and there's a good chance it's from your thyroid, unless you have cardiovascular conditions, which we'd want to look at as well. So weight gain, that's a big one. So you can retain fluid and you can just feel kind of swollen all the time. Some of the other symptoms, with the thyroid, cold and depressed. This is top 5 worst. This is number 4. When you're depressed all the time and you're cold. And yes, I do have our hack this week. Our Health Accelerator Challenge is cold showers, cold baths, ice baths. And so if you have a thyroid condition, you're not going to love this. But one of the things that the cold does is it pushes epinephrine into your body and norepinephrine. And so it can actually help you combat that cortisol steal, because cortisol is the stress hormone that can start robbing you from thyroid hormone. And so by getting some cold exposure, you actually metabolize some of that cortisol so your thyroid can actually start working a little bit better. And some of the research has actually shown that you have an increase in thyroxine, which is the active thyroid hormone, after being in the cold. So if you take cold showers every day, or actually the study was done with people who tended to have cold exposure on a regular basis versus those who didn't, and they found that the ones who had cold exposure on a regular basis actually produced more thyroxine. So interestingly enough, even though you hate the cold, you can actually get cold exposure and do even better. And then depression is a big thing because in Utah, for example, we are the highest consumers per capita of antidepressants, and doctors are writing out prescriptions like crazy. But one of the issues is, I mentioned earlier, iodine and tyrosine are 2 of the main molecules that you make the thyroid hormone with. And these 2 molecules, iodine, when there's granite mountains, which live right in the Rocky Mountains, so that they call it the goiter belt, the Rocky Mountains. When there's granite, iodine and granite don't do well together. They're not compatible molecules. And so we do have an iodine deficiency. And what can happen is that iodine deficiency can lead to a low performing thyroid, which can diminish your dopamine levels in your brain. And you guys know dopamine is that reward center. And so when you don't have dopamine firing, you can start to have symptoms of depression. So what I see is I say, well, about 50% of the patients who come in who are on antidepressants get off of those immediately, because we run their labs and we realize it's due to your thyroid. It has nothing to do with clinical depression. Yes, I'm not negating there are instances where patients have thyroid issues, hypothyroid, and clinical depression, and so we rule that out. But at least in 50% of the time, there's no real clinical depression. It's a hypothyroid condition. So that's number 4. Number 5, from all the patients I've surveyed in helping over 80,000 people, is this is where you have hair loss and brittle nails. And so we're going to do a fun little kind of exam right now, and I'm going to have you look at your fingernails, because my goal when we get to the end of this is for you to have better clarity on what's going on in your thyroid, and then you know what to do about it and have some answers. So how many of you have noticed, you're in the morning, you just by combing your hair and you see so much in the sink or on the counter and you're saying, holy smokes, how am I not bald, right? Or you go to just pick something up and you have a nail chip. So brittle nails and hair loss can be one of the major things, and especially with your thyroid hormone, that T3. Remember, it's the charge that lights up the Christmas lights. Every single cell in your body has receptors for thyroxine or for T3, including your hair follicles. So if you're not getting energy into the hair follicles, then the hair is going to be falling out. So here's some things you can look at. So grab your fingernails. No, just look at your fingernails. You don't have to grab it, especially if you have brittle nails. I just pulled one off, Reagan. But if you have brittle nails, you're going to find that that's a sign of hypothyroidism. So you can notice they crack easy, they splinter. That can also be an indication of low vitamin A. My son Jonah is just doing a research project on vitamin A, and I'm like, "Did you talk about liver?" And he's like, "Yeah, actually, I found that in my research." And so, liver is one of the easiest ways you can boost your vitamin A. Vitamin C, peppers are loaded with vitamin C. I mean, that's one of your best sources. And if you're taking collagen, which I recommend all of you take, make sure you have vitamin C with your collagen. That's what activates it. You can also have a biotin deficiency if you have brittle nails. So that's the most common nail pattern with hypothyroidism. But what you'll see too is if you look at your nails and you see vertical ridges, that can relate to an iron deficiency with anemia. And these vertical ridges, we see those very frequently with our thyroid patients. And so look at your nails real quick. Do you have vertical ridges? If you have yellow nails, and obviously if you're a smoker, then that's going to make your nails yellow. So reach out to us. We got to get you off the smoking. But the other thing you can have is diabetes, hypothyroidism, and psoriasis. And we see similar to with anemic tendencies and iron deficiencies, is we see a lot of blood sugar dysregulation with our thyroid patients. That's very common. And about 65% of the time, our hypothyroid patients also have some type of type 2 diabetes or prediabetes. You'll also see psoriasis. So one thing I left out of my story is I had skin that was peeling off my face, off my hands, sometimes in my elbows, behind the knees. And I had psoriasis, and it was really embarrassing. I remember as a teenager, sometimes I wouldn't even go out with my friends, after football. It seemed to get the worst in the fall, but after football, I'd take my helmet off and you could see all my skin flaking off, and it was really, really crazy. But when I met with the naturopath, he said, it's because of the glyphosate and the chemicals you're exposed to, because I was exposed to a lot of chemicals on the farm, moving pipe. We'd have these planes that would crop dust the fields, and I would just get soaked in the Roundup. Didn't think anything of it, but yeah, psoriasis was how my body dealt with it. That's the autoimmunity that came in. But you can look at your fingernails, and if you have nail pits or depressions in your nails, that can be another sign of psoriasis. You can have alopecia. If your hair is falling out in chunks, these are all really important diagnostic tools in looking at the fingernails. You can look at your tongue. And the tongue's another big diagnostic tool. Does your tongue have scallops on the side or like teeth marks? Is it swollen? Does your tongue look really pale? These are all symptoms of hypothyroid conditions in your body. And then if you have horizontal ridges, that can be a zinc deficiency. The horizontal ridges, or if you have little white spots in your nails, that can be a zinc deficiency, a blood sugar dysregulation, a yeast overgrowth. Can also relate to diabetes and kidney conditions. And then if you have dark streaks or marks, that can be, broken blood vessels. It can be heavy metal toxicity, psoriasis, heart infections, or even melanoma. So yeah, your nails. You probably never knew so much about your nails, and we even threw a little tongue diagnosis in there. So these are some of the 5 worst symptoms. So of these 5, which would you say are the worst? Is it the brain fog? Is it the depression and coldness? Is it the tiredness? You're like Post Malone and always tired. Is it brittle nails? Which one of these 5 would you say? Or is it the weight gain? I mean, so thyroid conditions are very prevalent, and I don't think that we are looking at it in the right way. And so one of the things that I've tried to do for the last at least 10 years is educate people on thyroid conditions. And so, okay, a few of you are raising your hand on, yes, I think I've got, those are some of the worst conditions. So, all right, so here's what we know. 1 in 8 women will develop a thyroid disorder in her lifetime. 1 in 8. And that number is actually probably low, considering the way that doctors are diagnosing hypothyroid is still inaccurate. 20 million Americans are estimated to have a thyroid disorder, yet 60% will not know that they have the condition. Women are 5 to 8 times more likely to develop a thyroid condition than men. So I got to tell you, I see more and more of my male patients having hypothyroid than I ever have. So I think these numbers will change. as time goes on. Usually the statistics are lagging a few years because it takes some time to gather the data. And so what we see, yeah, and some of you say, oh, weight gain and tiredness are the biggest thing with your thyroid. Got it, yes. But, if you think about this, it's like, well, if this many Americans have hypothyroidism, 60% don't even know. So 20 million, and then there's another 60% on top of that. That maybe turns out to be, over 30 million, about 35 million. That's a lot of us. That's 10% of the population. And this is with conventional diagnostic tools. I think what we'd find is that closer to about 50% of the population have an underperforming thyroid. And the good news about this is that means 50% of you have an opportunity to maximize your health and really take charge of it in ways you've never imagined. Because when your thyroid's working well, that's when your brain works well, your body burns fat effectively, you don't have the conditions of anemic tendencies and blood sugar dysregulation. You feel at the top of your game. So there are some good things about this. But here's the big problem. Here's what we're getting in that we've got to confront is how many of you have gone to your doctor and he says, oh, your TSH is great. It looks totally normal. Your TSH is a 3. Why are you concerned? Or, sometimes with the ranges, the labs will even broaden it to like 5, and so, maybe you've been told it's normal, but here's the problem is every year the labs will look at all their data and they'll analyze it. And one of the big markers that we've seen that keeps going lower and lower and lower in conventional lab ranges, for example, is TSH, but that actually goes up, but the main one is testosterone. And so testosterone, you can go and get your testosterone ran and checked. But the crazy thing about it is your testosterone might be very low, but it shows up as normal on a blood lab because they look at the general population and they say, as long as you fit within the criteria of 90% of the population, then we're going to call you normal. But if you look in America, we have over 2/3 of Americans have a chronic disease. I mean, that's incredibly nerve-wracking to me. With millennials, it's getting even worse. Our health is not getting better, it's gotten worse. And so we've got to be proactive about it. And if you look at the labs, they're just looking at numbers. They're not really analyzing the patient. So just because your labs and your doctor says everything looks normal does not actually mean that's the case. So here's just an overall diagnosis of hypothyroidism. It occurs when there's too little T3 and too little T4 in your system. And when there's too little of that, the TSH is like the thermostat, and that's your thyroid stimulating hormone. That's how we measure the activity of the pituitary, because the hypothalamus sends a message to the pituitary, hey, the body needs more thyroid hormone, more T3 and T4, and then TSH gets turned up. And so it's kind of like having a thermostat right there in your house when you need the house to be warmer or cooler. And the crazy thing is when you just use medication, that's kind of like having somebody constantly moving the thermostat for you versus having it be automated where you have like a Nest system. Like in my house, it's we can set it where we want it and it goes to a certain time frame, and then at night it changes if we want it to. But it's automated. That's like when your body can produce it on its own. When it can't produce it on its own, it's like you constantly have to fudge with it, which is why medications don't fix the problem. Well, a lot of us think that medications fix it. That's a myth out there. It manages the symptoms, and you might feel better on medication. I'm not opposed to it, but really the big goal is to not have medications, but to have thyroid health. So here's some of the symptoms: trouble sleeping, tiredness and fatigue. Talked about that, right? Difficulty concentrating, weight gain, dry skin and hair, depression, sensitivity to cold temperature, frequent heavy periods, joint and muscle pain. So how many of you fit that description? So your thyroid, just to give you some overall nuts and bolts, some of the mechanics of it, is part of your overall endocrine system. The thyroid hormone is known as one of the youth hormones, similar to growth hormone. If growth hormone is healthy in your body, your thyroid will be able to secrete the amount of T4 and T3 that your body needs. Your thyroid produces two main hormones, T4 and T3. And the 3 and the 4 relate to iodine molecules that are attached to that hormone. So the nice thing about it is your thyroid, if it has adequate levels of iodine, it can make plenty of T4. Your thyroid makes very little T3, which is the active version of the thyroid hormone. And so one of the things that has to happen is that T3 or that T4 has to get broken down into T3. And it's kind of similar if you think about a coffee bean. If you have a cup full of coffee beans, it's not going to do you any good, right? It's just like kind of sitting there. And that's like T4. It's like coffee beans circulating in your body. But if you really want to extract some of the nutrients and energy out of it, then what do you have to do to the coffee beans? Well, you have to grind them. And as you grind the coffee beans down, then you want to distill it, right? You want to put some water in it and then use your French press or have some drip coffee. And so the goal of T3 is to, and thyroid is to always have a constant drip going, dripping T3 into your body is like, remember, then you can go plug in the Christmas lights into all the cells at all the time. So your body's lit up. You have great energy. You have this light about you and this vibrancy. But the problem is, if you are unable to grind those coffee beans and distill them, then you're not going to have the drip. And so a lot of times we think, oh, the thyroid's not performing, we need more coffee beans. But just by putting more coffee beans into your system, you don't get any more coffee, right? You don't get any more energy. And so that's because your liver is not converting that T4 into T3, because at least 60, sometimes 70% of that distilling process happens right in your liver. And so if you have issues with your liver, then you're not going to break it down and you're going to be misdiagnosed with hypothyroidism, when the only reason your thyroid's not performing is because you're not grinding the beans and you're not distilling it properly. The distillation happens in the gut. And so many of you have infections or you have leaky gut or food intolerances. Those things can diminish that ability for your thyroid hormones to be activated. So that's some overall physiology. Here's what happens when you look at what your thyroid hormone regulates, because it's really interesting to me, but it regulates breathing, heart rate, central and peripheral nervous system function. So that means the stress, that's sympathetic and parasympathetic. That's why, how many of you have constipation, right? And you're like, I can't go to the bathroom well. And because you have thyroid issues, that's a big reason. The thyroid regulates body weight, it regulates muscle strength, menstrual cycles, body temperature, cholesterol levels, and metabolism. And so once again, it's like that Christmas light impact when you plug the cell into T3. When T3 comes in, the whole cell just lights up. The mitochondria just starts performing properly. It's just like jump starting your car, and you just feel amazing when you've got healthy thyroid hormones. And then you metabolize the food you're eating. It's like a pathway. It's like you need the light bulb, you need that spark to burn off the sugar and the proteins and the fats. But without the thyroid hormone, your pancreas doesn't function right, your liver doesn't function right. Even the thyroid hormone's responsible for peristalsis in the gut so that you can move the stool out. And what's interesting is the thyroid hormone regulates the stomach acids. And also there's this gland underneath your thyroid called the parathyroid, and that parathyroid gland regulates calcium. So if you want good calcium and phosphorus for bone density, you got to have a healthy thyroid, because the thyroid hormone triggers that. So it does so many different things in our bodies. And so often we just overlook the fact that it may not be the thyroid. It might be the distillation, in the gut. It might be an issue with your liver, not grinding the coffee bean. It might be an issue upstream where you've had a traumatic brain injury and your brain's not sending that signal to your thyroid. So there's a lot of things. It can also be stress, where your adrenal glands override everything that's going on, and that cortisol steals all the thyroid hormone away. So thyroid is very important if you have too much thyroid hormone. So you're like, oh, this sounds so great, Reagan. I'm just going to go take a bath in thyroid hormone. I'm going to get it naturally compounded and do bioidentical. And I'll be like, that's great, but too much can be really dangerous and not fun. Too much, you can actually die because of a heart attack. So hyperthyroidism occurs when there's too much T3 and T4. Remember, hypo is too little, hyper is too much, or accelerated versus decelerated. And so some of the symptoms of too much can include anxiety, irritability, or moodiness. And I find this with too little thyroid hormone, where you just feel grouchy, right? You got just like kind of little edgy, and then when you're tired, you're just like everyone seems stupid. It's just like it's not a good place to be in. A lot of negativity with the hypothyroidism or hyper. You can have weight loss, you can have nervousness, hyperactivity, sweating, or sensitivity to high temperatures. You can have hand trembling, hair loss, missed or light menstrual periods. All these things can come if there's too much. And so based on how your immune system's functioning, you can push the gas pedal too hard or slam on the brakes, and then your body doesn't function at all. And I've had one of my patients had been to 5 endocrinologists, and she said, look, all 5 of them have just tried to regulate my synthroid, and they've tried to put me on Cytomel, and they've tried to put me, if I get too high, and then they try to bring it down. Because a lot of you, if you have thyroid conditions that fluctuate, there's a good chance that you have some autoimmune condition that's driving it. And so that's an important thing to look at and to rule out, because that autoimmunity can be a very dangerous thing, because your thyroid gland's actually getting degraded. So your gland is being eaten and consumed and broken down by your immune system, because your immune system thinks the threat is in here in the thyroid. I'm going to start gobbling this thing up. And so you want to make sure that you take some pressure off of it by getting your immune system stable. That's why in phase 1, and I'll get into this, but in phase 1, we actually regulate the immune response. And because about 90% of all females who have thyroid conditions also have autoimmunity. So this patient who came to me, I asked her, I said, well, has anyone checked you for antibodies? She said, oh yeah, I have antibodies. I said, all right, how are you treating it? She said, we're just using thyroid hormone because my doctor said the treatment's the same, and, it doesn't matter if, it's an autoimmune condition. I said, all right, has your doctor talked to you about diet, no gluten, no sugar, no dairy? No, that hasn't come up. Okay, well, that might be an important thing. And what about traumatic brain injuries? Has anyone talked to you about that? Because she owned a martial arts studio. And she said, well, no, what does that have to do with it? I said, well, in your brain, you have the main the control board. It's like that's your main hardware for your computer. And your computer is like the hormones. When you plug into the keyboard, that's like how the hormones send messages throughout your body. And if the mainframe gets injured and there's inflammation in your brain, especially from a traumatic brain injury, then that can start to affect the way that your brain is communicating with your thyroid, and you're going to produce too much thyroid hormone or too little, or it's going to go, it's like a swing, it's a pendulum. It goes one way, then the next. And she said, that is crazy. I've had 13 concussions at least. I've been knocked out 5 times, and my thyroid became the worst after an automobile accident where I was rear-ended, and the airbag deployed and I hit the back of my head, and it just like knocked me out pretty much. And so, yeah, that was a big component. So we started treating her traumatic brain injury, and we did some neuro testing and got her on some anti-inflammatory program for the brain, and she started doing so much better. She's off all thyroid medications now, and her eyes aren't feeling like they're bulging out of her head. So there's a lot that needs to be looked at when it comes to the thyroid. In a conventional medicine process, it's more disease oriented, it's doctor centered. What that means is that it's based on, hey, you have 15 minutes and we just want to get to a diagnosis as quickly as possible. Once there's a diagnosis, the treatment is a drug. There's not going to be health coaching. There's not going to be a lot of mentorship, not going to be a lot of dialogue around why it's there and what the cause might be. Everyone's treated pretty much the same. It's very specialized. And the diagnosis in many times is based on symptoms. So even if your labs are off, the doctor can't ascribe medical necessity unless you've got the symptoms. So it's the way your health insurance is set up, which is why when we work in our thyroid programs, your health insurance is not going to cover these types of programs, because it's only based on symptoms that match a disease pattern, and then you get a drug. And so I know many of you have been down that road. Functional medicine, however, It's patient-centered. It's program-based, so that we in our programs we use the 3-4-5 method, and that means everyone gets the right testing, the right treatments, and then the right mentorship or health coaching. And then we focus on removing the 4 triggers. So the triggers from, physical stress, emotional stress, chemical stress, and immune stress, because so many of you have Epstein-Barr virus that is also prevalent in about 80% of the thyroid patients we work with. And then functional medicine is where we look at underlying causes of diseases. And then we take more of a preventative, but we also do more of an optimizing approach. So it's not like, let's just get rid of your thyroid symptoms, but let's get rid of your thyroid symptoms and help you get healthier in the process. And that's why we take you through the hacks, the health accelerator challenges. Every Wednesday, we have a new challenge that we give you. That's how we do mentorship and coaching, but it's also how we help you optimize your own health. And so there's, 2 different paths you can take when it comes to thyroid health. So, in the conventional strategy, it's like, well, if your labs look good and your numbers look solid, then the treatment's working, right? And so your doctor will, pat herself on the back and say, everything's fine. But you're wondering, like, when is this going to start to work? Because it works for a couple of weeks and then it doesn't. So conventional medicine strategy is like, well, let's get you on more medication. And so we'll combine it all into one convenient dose. And then you got a pill that's the size of your head, right? And so unfortunately, we find that there's this condition called Polypharmacy Syndrome, which means if you're on 5 or more medications, you have a 100% chance of having an adverse reaction to one or more of those medications. So we realized that just by taking the conventional medical strategy, you may end up on more medication, which is not always beneficial to you. And so what the functional medicine approach looks at is 3 primary phases of care. And if you miss any one of these phases of care, there's a really good chance that you're not going to get the results you're looking for, and you'll end up frustrated. You'll spend a lot of money because these services are out of pocket. You'll spend a lot of time. You'll go to the holistic doctors who will just say, well, all we got to do is this gut protocol. And then all we got to do is fix the hormones. And they send you in circles where there's not a path. There's not a path of progression. And so what we do is we work with our patients for 6 months, 12 months, 18 months, based on the severity of your labs. And then we can properly take you through every phase of care. And so phase 1 is removing the thyroid triggers. So these triggers would be, what are the physical triggers? Just like my patient who had the traumatic brain injury. What are the triggers that we need to remove there physically? Whiplash, if you've had neck issues, or even if you don't have a good cervical curve in your neck, that's going to impact your thyroid. The second triggers we want to remove are the emotional triggers. And so this is where we say, if you're going to work with us in a thyroid program, you've got to get rid of any negativity in your life. And so that may mean you live by yourself in the woods in a cabin. Okay, maybe not that extreme, but you know what I mean. If there is certain relationships that are very toxic, it's a really important thing to create some boundaries there so that you can get some healing. So emotional stressors, and we aren't therapists, but we have some great ones we work with. The third one is the chemical stressors, get rid of plastics. That's been one of our challenge in the hacks. Get rid of plastics as much as you possibly can. They're everywhere. Watch out for pollution. Get an air purifier in your house, especially when we have inversions. Make sure that you are eating organic foods. Look at the Environmental Working Group, the EWG.org website, and start looking at your cleaning products and the makeup you put on your face and all of these things. These are big triggers. And the other thing that can be a trigger are the foods you're eating. So watching out for the gluten, watching out for the sugars and the dairy. All these are molecular mimickers, which we'll talk about in a minute, that can trigger a thyroid response. And then the final one are those immune triggers. And those can be deadly. The Epstein-Barr, the Lyme, all of the infections in your immune system. It's rare that we find a patient who has a thyroid condition that also does not have a compromised immune system. So that's phase 1, where we remove the triggers. So it starts with the functional medicine evaluation. We sit down with you and we analyze what your goals are, your hopes, your needs. In our programs, it depends on the clinic, but we can only accept 3 to 5 patients per week in our programs. And so we have a very limited amount of time in our schedule, but we want to make sure that when we enroll you into a thyroid program, we've got the capability to really deliver on that. And we like to have people enroll in groups, because as you enroll with, 3 or 4 people or 5 people, you're going to find that you guys actually, you progress together along in the hacks, and then you'll do your orientation together. And so it's actually a really fun little way to meet people. And if you don't like to meet people, you don't have to be involved in that. You can just do it all virtually, and no one needs to know you're there. But we find that it makes it improves your experience and our experience. So one of the things we do once we do the evaluation, we start looking at the pathways. And so this is where we run your functional blood chemistry, and we run your gut test and your salivary test for your cortisol. But that way we can find out, well, is the problem, is your body not making enough coffee beans, right? Do we need to increase that? Or are we not grinding the coffee beans, or are we not distilling them? So what part of the action of getting that T4 to T3, where are the lacks? Where are the imbalances? So when we look at all 5 pillars of health, we do tests for gut health and nutrition, gut detox pathways, fitness, hormone, and brain health. And by starting with functional blood chemistry, this is really where we can start designing the overall plan of action to get you out of the thyroid condition that you're in. So this is an example of the functional blood chemistry. This patient here, you can see in the yellow where it was outside of the normal ranges. So, if you're coming up on a yellow light, you need to either push on the gas or hit the brakes, right? So we look at your labs and we let you know where you need to either accelerate and get out of there, or hit the brakes and reverse, go the other way. But this particular patient, we found 23 issues that were outside of optimal range. And then in the standard range, this is where there's a disease pattern. This particular patient had 8 of these. And so that was like, okay, so now she's got 31 positive findings. Then we found 4 in the pink area. And what the pink, we recognize that's more of an emergency or an alarm level. So we've got to focus on that right out of the gates as a priority. And so we found that there is a total of 35 positive findings. And so anyone who has less than 30, anywhere between 10 to 25 or 30 at the most positive findings, usually it's about 6 months to get that condition corrected. Anywhere from about 28 to 38 is going to take about a year to fully get this patient's systems resolved and get the cells active and get them receptive to the thyroid hormone again, get the brain producing it, and the liver distilling it and grinding it. But anyone over that, over that kind of 35 to 38 range, closer to 40, it's going to take a year and a half. So when we put your program together, if we run your functional blood chemistry up front, which sometimes sometimes we'll take blood labs you've already had ran, and then we'll rerun our labs once we get you through phase 1. But these labs give us a very good parameter as far as what it's going to take to fully get your body taken care of. Then we use science-based nutrition. So we'll let you know, are you absorbing and getting enough vitamins? Are you getting enough fats in your diet? How's your hydration levels? What about your carbohydrates? A lot of my thyroid patients don't eat carbohydrates, and they don't realize that it's the carbohydrate that helps your body convert the T4 to T3 and create that active thyroid hormone. We look at minerals. Are you getting enough minerals? Because remember, selenium, zinc, magnesium, copper, these are all really critical minerals for your thyroid. And then we look, are you getting enough protein? The other thing we want to look at is birth control. Birth control can really impact your thyroid health. And then the foods you're eating. So many of you, if you want to start right out of the gates, there was a study that they took thyroid patients and they had a certain amount avoid gluten. And they said, okay, avoid gluten for a month. They did a symptom survey, and 80% of the people who avoided gluten came back feeling better. Actually, it was 82%. And then they had another group and they said, okay, avoid dairy. And so this group of hypothyroid patients avoided dairy, and casein is the protein in dairy that is the molecular mimicker. So our body mistakes gluten and mistakes casein, or that protein in dairy, as a threat. And so it looks like it's a pathogen. And so our immune system starts attacking and attacks the thyroid. But really what we found is that in this study, 78% of patients who avoided the casein also felt better, or the dairy. So these are some important triggers that we want to get rid of. Once we get rid of those things, we start looking at all the factors. Is there stress, trauma? Are you on a low carb diet, inflammation, toxins? All these things can affect, this reverse T3 and the T4, T3 conversion. Are you getting enough vitamin A? Are you getting enough exercise, enough zinc, enough selenium, enough B vitamins, enough tyrosine and iodine and iron? All these things are looked at. And then we look at heavy metals as well. And so, then we get you on the right nutrition, the right food pathway. We help you avoid some of those foods, not just the gluten and dairy, but even eating a lot of cruciferous vegetables, which you're probably saying, what do you mean, Reagan? That's not good for my thyroid. But there's actually goitrogens if you eat large amounts of, broccoli, cabbage, kale, soy, Brussels sprouts. Those can trigger an autoimmune reaction. And yes, they're very good for you, but you've got to cook them. And then we make sure you get off the refined products, anything artificial sweeteners, flavors. These things are very dangerous for your thyroid hormone. So these are some of those triggers there. And then even drinking water. Many of you don't want to hear this, but there's a study done and they found that just by drinking tap water alone that did have fluoride in it, and by the way, almost every municipal source of water has fluoride in it. Fluoride is a molecule that competes with iodine, as does bromine. And so the fluoride, what they found is that after drinking tap water for 1 week, participants in the study actually started to have hypothyroid conditions. So their body actually started to weaken in its ability to produce T3 and T4, and TSH went up. So that's get rid of the fluorinated water. That can be a big thing. But once we've gotten rid of those triggers, that's when we move on to phase 2, which is repair the thyroid damage. And this is a really fun phase that can, phase 1 can take anywhere from 1 to 6 months, depending on how many triggers you've got. Phase 2 can be, once again, this can be, 1 to 3 months or 1 to 6 months, depending on how, damaged things are. But what we do is we assess where all the stressors are. We start correcting those things. We correct the body physically. We correct the liver's function. This is where a lot of the liver detox comes in once we've gotten some of the pathways opened up, and then we work on the immune system. We start working on the correct movement therapy, because exercising every day is one of the best things you can do for your thyroid. Not too much, but just enough. And then we also start introducing certain peptides. So some of the peptides in phase 1 are epitalin or thymosin alpha 1 or KPV. And these peptides help stabilize that immune function. But when we go into phase 2, this is where we use BPC 157, thymosin beta 4. And these are really powerful, especially if you've had autoimmune conditions. And so that's a really important thing, because thymosin beta 4, it reduces the amount of scar tissue, it's anti-inflammatory, and it's actually the first peptide that is stimulated when your body gets injured. And so many of you remember, over 90% of women who have hypothyroidism have an autoimmune condition, which means your tissues are being injured. And so thymosin beta 4 helps create better tissue healing and tissue response. And then we go on to phase 3, and this is the exciting phase, because once again, we're not just trying to get rid of symptoms. We do want to, remove the triggers, repair what's been damaged, and then we rebuild and regenerate the thyroid. And we do that with acupuncture, Chinese herbs. We do that with peptide therapy, which help stimulate the communication from cell to cell so that you're not dependent on hormones. And some of the growth hormones that we use peptides to stimulate growth hormone, because remember, growth hormone is one of the most powerful hormones that can help stabilize your thyroid function. So our growth hormones decline by the age of 40. They've declined over 60%. And as we age, this number continually declines. So one of the peptides we use is CJC ipamorelin, And that actually helps improve your growth hormone by 7 times without the dangerous side effects where you have increase of cortisol or acetylcholine or prolactin or aldosterone that can come with growth hormone just using a hormone alone. So that's a very amazing thing that we use. We use sarcotropin, which is a nootropic. It helps with the brain, helps with the muscles. It's got L-leucine, L-arginine, and it's got L-pyroglutamic acid, which can all improve circulation for you cold people. And so all these things, they work in conjunction with each other in the regenerative stage. And so here's what one of our patients said. She said, these guys are super helpful getting me back on track with my thyroid Graves issue. They helped me before and I got lazy with my eating and stress management. Now I'm back on track and feeling much better again. Love these guys. They really know what they're doing. It's an amazing clinic. So come, for those of you who are ready to take action on your thyroid, get in touch with us today. We will run the right tests up front. We'll get you the right treatment strategy and we'll put you on our 3 phases of care. And we'll connect you with the right health coach. We'll give you your functional medicine review and design, and then we'll help you get back on track. And so the only thing that should be getting in your way at this point is procrastination. And I love this, this meme here. Look at all these consequences of procrastination: stress, insecurity, insomnia, self-justification, poor health, diminished happiness, depression, poor thyroid health, I'll add in there. So stop procrastinating today. Make sure you get your thyroid checked out. It can be one of the most important things you do in your entire life. You can reach out to us. We'll provide a number. You can go to AcuEastWest.com and let's get your thyroid healthy. So thanks, you guys. We will see everybody next week. Love you all and good luck on your hack getting the cold today. Bye-bye.
All right. Oh, Reagan, you going to stick around for a sec?